Hi, everyone. My name is Mohammed. I am the director of the Global Pharmaceutical Services Unit here at International Medical Corps. I'll be presenting today about a pharmaceutical information management system that we call PIMS that helps us in managing pharmaceuticals at the last mile of the supply chain. As you can see, we are global first responders. We work close to 37 different countries in all the 6 continents. We've been in this business for the last 37 years with over $3.6 billion in spending and covering about 80 countries. So basically, we are a non-government organization internationally active in responding to all types of emergencies, from the tsunami in Japan to the earthquake in Indonesia or Nepal to the Ebola response in West Africa. And currently, we're also very active in responding to the COVID pandemic. We have a little over 7,500 staff, about 90% of which are actually local staff in country. We work in different areas of health services. Of course, our first and bread and butter is emergency response and preparedness, but we deliver immediately after the acute onset of emergency. We deliver a comprehensive package of primary healthcare services that includes family and community health, women's and children's health, mental health and psychosocial support, nutrition, and water and sanitation as well. So it's a very comprehensive public health service that we provide to places where we work in. With that out of the way, let's talk about a little bit about the pharma supply chain. The pharma supply chain, as you all know, includes several aspects of the logistics part of it, starting from sourcing, procuring, transportation and importation of these pharmaceuticals into any country, any given country. And then, of course, through it all, there's going to be a lot of management. But the problem that we faced in our organization, at least, and similar, humanitarian sector, is that there is always a gap in data. Data is not collected properly from the field sites and from the last mile of the supply chain, so to say. Basically meaning once the drugs are brought into country and then stored in the central warehouse, then distribution happening to the health facilities. There is a lot of gaps in terms of data collection, whether it's going to be inventory, stock status, expiry, alerts, or even dispensing and consumption reports from the pharmacy itself, from the dispensing sites itself. So this software that we designed covers this part of the supply chain, basically from the central warehouse all the way to the patients. We collect data, we manage data, we help planners and managers to plan based on actionable analytics and information that has been collected from the services that we provide out in the health facilities. And we call this software the Pharmaceutical Information Management System. It's basically a generic name, but we call it PIMS in short. This software, again, as I stated earlier as well, was designed basically by the actual users. It's designed by doctors, pharmacists, logisticians, basing ourselves on the humanitarian context because we are, after all, a humanitarian organization. We respond to emergencies. So any software or any design that we put into the software has to play a role in making our responses and our services much better and efficient. So we used an open source technology and a modular design and to make it more versatile and expandable. The modular nature of the software, which I will share with you in a bit, is going to be really helpful in adding, customizing, and expanding the software in any setup. All the data that we have in that software is encrypted. It's actually HIPAA compliant here in the US. And The software also has a multilingual platform. Currently, we're running the English version and also the Arabic version for our Middle Eastern missions. But we're also getting ready with the French version as well. So the platform is ready. It can take any language that you might probably throw at it. We have it in a mobile version as well. We developed an Android version. We have the software peer-reviewed by Management Sciences for Health for several months, actually. And we made several improvements after that peer review as well. It's copyrighted here in the US, and we're in the process of copywriting it in the Asian countries and also in Europe as well. The software, as I mentioned, is a modularly designed software. As you can see, the different modules are displayed here. The rationalization module is actually the first module where we do rational selection, quantification, and forecasting. And then we have the items module, the good receiving module, and the dispensing module, and the physical inventory and resupply module in managing the supply as the goods flow from one place to the other. Basically, from a warehouse to a health facility warehouse or a pharmacy store, and all the way to dispensing the medicine to our patients. And if in an unfortunate situation, if we have to dispose any medicine, if it's expired, we still have also to account for those. So we have also the disposition module. And then if there is any transfer needed from one clinic to another, there is also the transfer module for that. And of all of the modules, the most important one, the reporting module, where data actually is crunched, analyzed, and prepared in different types of reports as needed. It's, as I said, the modular design actually is very, very helpful to make the software so customizable, so versatile, and flexible in responding to any need that we might have out in the field. And then the advantages, I'm just simply listing a few of the advantages. As I mentioned, it's an end-to-end solution for pharma management at the last mile, basically from the central warehouse all the way to the patients. Can handle multi-grant projects or multi-location management. If it happens to be in a government setting, you can manage multi-locations, large-scale multi-location health services can be handled by the software. It has a very robust selection and quantification module where the output can be configurable based on your requirements. It has a comprehensive pharmacy module that includes a barcode system. It can scan barcodes from manufacturers. And then it does inventory perpetually. Basically, inventory is instantaneous. It's always there. It's always updated after every dispense that we do at the pharmacy level. And the pharmacists are also equipped with these last two pieces of the software where drug utilization review is conducted automatically, and any drug-to-drug interaction alerts are displayed on the screen before the actual dispensing happens. So the pharmacists are equipped with this tool as well. And then currently we have over 760 drug-to-drug interactions coded into the software. But again, as I mentioned, it's very versatile and customizable, and you can add thousands and thousands of drug-to-drug interactions that apply to your functions. There is also the pharmacovigilance component of the software where patients may probably bring in any adverse reactions to their dispensing medicine to the pharmacist, and we have a way to document that in the system and also link it with any referral system that might exist in any country. The dynamic alert system that is engineered into this software is really capable of actually alerting managers, pharmacists, pharmacy managers, health directors, or health coordinators at the mission level to act before even anything happens. For example, out of stock scenarios or possible overstock scenarios about a specific drug. The system can be coded to alert based off of any factor that you put in, any attributes that you code into the software. The alert system can continually alert and send emails to these managers and pharmacists. The resupply calculation is automatically done, so the pharmacist at the health center can only just simply click a couple of buttons and prepare their resupply request to the warehouse and send this through a system of networks, which is very, very simple as well. Again, reports are on demand. They can be customized. You can send any regular organizational reports or internal or external reports as well. And another very beautiful aspect of the software is the API, the application programming interface that we coded into the software. This software can interact with any ERP software at the warehouse level, or finance softwares, or clinical softwares for that matter. So you can link this software to others so that they can talk to one another through this API system that we coded into the software. It's also available online and an offline mode as well, or either on a desktop or a mobile version as well, because of the Android version of the software that we created. The data transfer is very simple. It's very easy. It can be transferred through a Wi-Fi network if it's available, over cloud, or even files can be transferred on paper, like on barcodes or any QR codes as well. And again, as mentioned earlier, it's either can be used for a low or high volume operations in mobile or stationary clinical setting. For us, it has really been a real game changer. Honestly, it has really transformed some of our services from literally from zero to heroes. It reduced pharmacy dispensing time at the pharmacy level per prescription from a minimum of 4 to 5 minutes to an average of 45 seconds, which means there's going to be a lot of leftover time for the pharmacists to counsel and advise the patients in how to take the medicine and answer any questions that the patient might have about that prescription. So it makes life very easy for the pharmacist as well. The resupply request, as I mentioned, we calculated it in many places. It dropped from days to a minimum of 8 hours to about 30 minutes in using this software. Consumption reports can be compiled in minutes, basically a couple of clicks away. In some places, it used to take us days actually to get any consumption data from any clinic. But in this particular software, it's a matter of clicking a button and then consumption report is done for any period that you set out to collect information from. We eliminated all of paperwork, basically tally sheets and all sorts of data collection paperwork, Excel spreadsheets, what have you. And we use the system to collect data at the health facility level. In some places, it significantly decreased, but in the majority of the places, we totally eliminated stockouts and overstock scenarios. Unless we are totally out of stock at the warehouse level, at the clinic level, alerts are there to alert stockouts, and requisitions will be put immediately. Overstock scenarios can be managed by pharmacy managers to redistribute supplies to other health facilities for immediate consumption. Expiries have totally been eliminated, actually. First come, first, first expire, first out. Systems are really active using this system. Excuse me. User training on the software, it really takes a few hours. And in some cases, if the person is familiar with computers and mouses and scanners, it takes basically minutes. We have trained a pharmacist in South Sudan who has a pharmacy technician who is a 65-year-old pharmacy technician who doesn't have any experience with computers except for his cell phone, in hours. We trained him in a couple of hours, and on the third hour, he was dispensing medicine using the system. That's how simple this software is. And definitely, Dr. Yazeed, my colleague who is also here with me, will be demonstrating the software in a bit, and we'll show you some of the interfaces on the software and what it looks like in actual live demo. Our roadmap for the future definitely will continue our global rollout of this software to the rest of our missions. Currently, we have the software in use in Jordan, in Iraq, Yemen, of all places, and Libya, in South Sudan, and we're about to roll out in Somalia, in DRC. So as you can see, we work in some of the most remote and difficult places, even security-wise and infrastructure-wise. But this software made it possible for us, because of the nature of the software, it made it possible for us to deploy this software into these types of countries and these types of projects. And of course, we're open to partnerships with other NGOs, with any other government entities as well, Ministry of Health, where we can really help out in managing data at the last mile and making sure that pharmaceuticals are managed properly from the warehouse all the way to our patients. With that, I'll stop here and I'll let my colleague, Dr. Yazeed, who is our brain behind all of this software. He will introduce himself and show you some of the frameworks of the software. Dr. Yazeed, please.
Thank you very much, Dr. Mohammed, for this introduction. So I'm Yazeed Ayasra. I'm a medical doctor and a software developer. I'm the director for health systems and application at International Medical Corps. Thank you all for joining this and allow me to share my screen and show you around some of the major software interfaces. Please confirm if you can see the screen.
Yes, we can see it.
So as you can see here, once you log in into PIMS, you land on the dashboard. This dashboard is configurable based on the user permissions and based on the user preferences. The dashboard that you see here contains analytics around quantitative and qualitative data on the operations that are going on in the facilities and pharmacies that are running the software. As you can see here, you have graphical representations. This one, for instance, is a Pareto analysis that shows the items that are being dispensed in a specific facility. The software also, as you can see here, is categorizing the prescriptions that are being dispensed based on their therapeutic categorization for decision makers to take into account. There's a lot of different graphical representations that you can add or remove from the software settings. The dashboard also allows the users to have their to-dos in front of them, such as any transaction that is waiting for action. As Dr. Zurga has explained, PIMS progressively alerts patients whenever an anticipated stock out, overstock scenario, expiry alert, or any kind of stock hazard for that matter. The software keeps an eye on the stock and keeps an eye on the consumption trends to come up with timely alerts to make sure that decision makers, supervisors, whoever is using the tool is well informed if there is any problem that is anticipated regarding the stock in hand. So as you can see here, the software generates alerts for stockouts. It generates alerts for expiry or expiring products, as you can see here. Allow me to emphasize here that we're using a mock database in this example. So this is a training version of the software. This data is for presentation purposes only. And as you can see here, you have the overstock alerts. And what the software does is that it keeps on analyzing the operations that are going on and the processes. And whenever a hazard is coming up, the software alerts and generates that alert, and it sends out notifications and email notifications to depending on how you have configured the software, to make sure that everyone is informed around any anticipated hazard. Allow me to show you the dispensing interface. So I'm going to show you what the pharmacist usually has to deal with on day-to-day while dispensing using pumps. So this is the dispensing interface. This interface is equipped with a lot of features that would help the pharmacists throughout their day-to-day routines. It alerts whenever there is a duplication of service. It alerts whenever there is a drug-to-drug interaction. And all what the pharmacist has to do is to fill in the physician, the patient, and select the morbidity if it was configured to do so. And as you can see here, the software alerts that this specific patient has an allergy to penicillin, to make sure that this is a safe prescription. The interface accepts barcode scanners, the QR scanners, RFID scanners, any plug and play scanner for that matter, can be hooked up with PIMS and can extend PIMS's operations, and it could be used as a data entry tool on the software. So what the pharmacist has to do at this point is only to scan the medications to get them populated inside the interfaces. So once a medication is scanned, it gets populated inside this table. And as you can see here, there is a possible duplication of service, because if we go back to the history of this patient, we will see that this patient has had paracetamol earlier today, and that's what has prompted this this message. And of course, the pharmacist can override, and the software, as you can see here in this example, keeps an eye on the medications that are being dispensed and the medications that were dispensed historically to the patient to make sure that there is no drug-to-drug interactions. And the software makes sure to intervene whenever any hazard is in the way when it comes to a specific prescription. As any other supply chain tool, the software has a lot of modules that take care of the different types of transactions. You have the GRNs module for receiving items. You have the transfers module. You can exchange items among different facilities, or you can dispatch items to facilities that do not have PIMS. The software is equipped with a robust periodic inventory module. This physical inventory module has many different pre-configured and pre-coded inventory modes to choose from. And the software has a stock adjustments module where you can issue out damaged products, expired products, and so on. Of course, you have the quantification and forecasting tool equipped with PIMS, which is the first module, as was explained by Dr. Zurga. The tool allows decision makers to visualize what kind of stock they're going to need and what kind of medications they have to procure for the upcoming resupply cycle. As you can see here, you have the ABC analysis, you have the Pareto analysis, and the overall cost of a specific project. Of course, all of this relies on the user inputs and the usage of the software. Allow me to walk you through some of the reports on PIMS. This is a facility report. I'm going to choose a duration of time to extract the report. Every report that is built into PIMS could be configured and could be queried in different ways based on the user preferences. So there's a lot of filters to be applied to each one of those reports. As you can see here, this specific reports in a few seconds has highlighted everything that has happened in 2021 for that facility and showed us all of the items and what was the opening stock, what was coming in, what was going out, and everything all the way back to the end stock that we have right now in hand. Another example of a report that the software allows, and this one shows the capacity of the tool. This is the movement tracker report. You can see a timeline, basically, of everything that has happened to a specific medication in a specific facility. And as I've mentioned before, you can query the data to be filtered based on the preferences of the user, and that would allow the report to basically answer any question that you would have regarding the stock or regarding any specific item that you have. So as you can see here, this is the timeline of everything that has happened to paracetamol in that facility, and the software sums up the whatever was coming in or going out. And as you can see here, the software gives you references to the transaction, the waybill, the GRN that you have received or dispatched this item through, as you can see here. The list of features goes on and on. There's the items module. We have a lot of features inside of the dispensing module. It is equipped with the chronic prescriptions, and this tool, as Dr. Zurga has mentioned, could be synced with an EHR, an electronic health record system, to receive prescriptions directly into the software without having the user to even fill in the data. We have pharmacovigilance to report back on any side effects for a specific medication, and you have a very robust settings module that allows you to control the tool and to contextualize it based on the needs. So these are some of these software interfaces. For the sake of time, we cannot go over everything, but please reach out if you want to know more about the software and let us know. Thank you.